Let me know when we are ready.
Will do. Oh, here's Aurora. You can get started whenever you're ready.
Right. Welcome, everyone. Hope you're all staying safe and healthy. I'm glad to see you all here today. This meeting is being live streamed on YouTube on the Palmdale 2045 channel, and it's also being recorded. For those who are joining us for the first time on YouTube, I'm Simran Malhotra, principal with Ramey and Associates. We are leading the general plan update for the city of Palmdale. I would like to call the meeting to order at 6:31 p.m. And start with introducing Carleen Saxton, Acting Director of Economic and Community Development for the city of Palmdale, to make some opening remarks. Carleen.
Thank you, Simran. Good evening, everybody. As always, it's so wonderful to see everybody's face. We appreciate everybody being so committed and showing up on time. And I know that there's been a lot of material sent your way, so we appreciate everyone spending the time to look at that and listen to what we have to say tonight. Obviously, this is a lively, very exciting topic, something that is holds a lot of passion for a lot of the people on our GPAC and our community. So we look forward to hearing what you guys have to say and leading this conversation. So we appreciate that. And then Simran, I think you're going to introduce the rest of city staff as well?
Yes.
Awesome. Thank you.
And just briefly before I do that, we'll be talking about health equity and environmental justice in Palmdale during this meeting. To introduce the rest of the general plan team here, we have Megan Taggart, who's the acting planning manager at the city, Benjamin Fiss, who's the senior planner with the city, and from the Ramey team, I have Melissa Stark, who is helping out today. I would also like to note that Joe Parisia has resigned from the GPAC as he has moved out of the city of Palmdale. Colby Estes is now a regular member instead of an alternate. Let's do roll call. Please wave or verbally acknowledge when I call your name. Tony Avila.
Hello.
Juan Blanco.
I am here.
Lourdes Everett.
Present.
Colby Estes. Laura Gordon.
I'm here. If you didn't see me wave. So.
Yes.
Here.
Teresa Hambro.
Hello, everyone.
Matthew Harris.
Here.
Aurora Hernandez.
Here.
Pat Hunt.
Present.
Sherry Kaneshiro.
I'm here.
Terry Lamping.
Hi, everybody.
Debbie Rutkowski-Hines.
Here. Hi, everyone.
And Jason Zink.
Here.
Okay, great. We have quorum, and actually everyone is here in attendance. Now Melissa will lead us in the Pledge of Allegiance. Please mute yourself, and so we can all hear her clearly.
Yes. Please stand. Place your right hand over your heart and repeat after me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You may be seated.
Okay. First order of business, the meeting minutes from the last meeting on September 23rd. Do we have a motion? Or are there any corrections first, I guess I should ask?
Well, clarification on the minutes. I think Debbie made a motion to approve the minutes and I seconded, but then I asked if we could get the minutes earlier, shortly after the meetings, and that doesn't kind of reflect that the way it's written, but that's just clarification.
Okay. We can update that. We did send the meeting notes out fairly soon after the meeting.
That was
but
awesome.
We'll make sure that the meeting minutes reflect that.
I'll make a motion to approve the minutes.
I'll second.
So Pat Hunt makes the motion and Juan Blanco seconds. Great, thank you. All in favor?
Aye.
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 Any opposed?
Aye.
Any opposed? Oops, sorry, Melissa, I forgot to run the poll.
It's okay. Yeah, if you'd like, we can do this over the Zoom poll. I can launch the poll now,
Sure.
and you can simply click approve.
Yeah, that's good practice too for the poll feature again.
Okay, we have 100% who've approved. Going to just
I
share the results
actually-
with you briefly.
I'm sorry, Teresa here. I'm actually going to abstain because I wasn't at the meeting.
Thank
Okay.
you.
All right, motion passes.
Thank you all.
All right, so let's get started on the rest of the presentation. We'll be stopping along the way for questions and answers, and we'll also have some poll questions for you. I would respectfully request that all members keep their questions or comments short and to the point so that everyone has an opportunity to participate. And now to the topic for today's meeting, creating healthy, equitable, and environmentally just communities. We often hear the terms equality and equity used interchangeably. However, there is a difference. Equality looks at providing people with the same level of resources, regardless of any other factors, such as race, gender, income, place where they live, or education. So the image on the left shows equality as everyone receiving the same size box or resource. But they're not all at eye level, so some people have more access than others. Communities of color and low-income populations often have less access to resources like affordable housing, transit, or safe bicycling or walking routes. This impacts their quality of life and makes it harder for them to thrive. Equity, on the other hand, is about fairness and ensuring that people have access to the same opportunities and have what they need to thrive and succeed. And at the end of the day, socioeconomic and environmental factors should no longer be able to predict life outcomes, and outcomes for all groups are improved. So in the graphic to the right, we see that these boxes are of varying in size to make sure that everyone has the same level of access to opportunities. All are at eye level and can see over the fence. So we need equity before equality can be reached. And please keep this distinction in mind as we go through the presentation. And along with these questions, please keep these questions in mind, and these were on the worksheet that we had sent over earlier this afternoon. What are the most critical health and equity topics that the general plan should address? And what ideas do you have for improving health and equity outcomes in Palmdale? What goals should we be looking at? What are specific targets that we might strive for? And how do we measure success with these goals and policies that we establish? And then later on in the presentation, and we want to spend a good amount of time with you in the second half of our meeting today to learn your ideas of what specific policies or actions we should take to improve health and equity within the city. So all general plans are required to address a state law that was passed in 2016. It was SB1000, also known as the Planning for Healthy Communities Act. So since 2018, which is the date the law went into effect, SB1000 requires that city address health disparities and environmental justice issues in low-income communities within the area covered by their general plan. And they've outlined, the state law has outlined a three-step process, which is on the screen in front of you. The first one is identifying disadvantaged communities, which are state identified or are low income areas with high pollution exposure or other health risks. The second step is engagement with community members in these communities to identify their priorities. And then the third step is the integration of goals, policies, and programs to address disparities. And we are in step one today. We have done this initial analysis, identified disadvantaged communities, and we will modify this analysis based through the engagement process. And you as the GPAC are the first step in that conversation with the larger Palmdale community. And as we go through this analysis, we want to hear from you what your experiences are with the data that's available. And we will also be ground truthing some of this analysis, the findings that we are presenting today. This graphic, which is very complicated, but it essentially describes the methodology the state has established for use for identifying disadvantaged communities. And it has two steps. Method one uses a state-established CalEnviro screen tool, which uses a composite score. The CalEnviro screen tool is based on Census Tracts, and it looks at pollution burdens and population characteristics for a total of 20 different indicators. Method two, which is in the center of the screen here, starts with the identification of low-income areas within the city, and then layers on individual pollution indicators such as ozone pollution or groundwater threats. It then considers health outcomes as well as built environment indicators. The composite of the results in both method 1 and 2 together lead to the identification of disadvantaged communities. This chart describes the 4 major indicator groups that need to be considered in our analysis. Environmental pollution, built environment, and health outcomes, along with population characteristics such as income, race, ethnicity, or educational attainment. While not a factor on their own, in combination with the other factors, these social characteristics have been linked to disparate outcomes for certain groups. And now before we walk through the individual characteristics listed on the screen, I'll pause for any questions that you might have, and then we have a couple of questions for you. Any questions so far on the state law or the methodology that I've described? Okay. Melissa, did you want to run the 2 polls?
Yeah.
4 questions?
So we will start. So we're about to open our next poll. These have 2 questions, and they're quite short. So the first question asks, do you think there's an issue of equity in Palmdale today? And your options are yes or no. And the second question is, are we missing any factors to establish health and equity? And again, your options are yes or no. For folks who are watching us on YouTube right now, there is a link in our YouTube description that will take you to a comment form where you can actually respond to these same poll questions. We'll spend another minute here. Almost everybody has voted. If you haven't yet, please put in your response. Okay, we're going to end the poll and share the results now. So 75% of folks said that they do think there is an issue of equity in Palmdale, and 25% said no. The second question, we have 67% said no in terms of are we missing any factors to establish health and equity, while 33% said yes.
Did those who think there are missing factors want to quickly share what those factors are?
This is Tony. I think earlier, well, we still haven't established, or we haven't talked about the equity and the physical fitness. So I don't know if you want me to bring that up.
Okay.
I noticed that the numbers are vastly different from one side of town to the next side of town, and obviously something needs to be done to, if you're talking about inequity, and we all voted on that for a majority, then there has to be some factors that go into that. And on the physical fitness side, I think a lot of it has to do with economics, people not being in organized sports, maybe parks that are adjacent or close to these folks' homes and things like that. So I would say that there is some inequities, and we can go on and on with that.
Okay. Yeah, actually, linked to physical fitness is one of the indicators we use is obesity, and that's one of the factors, and it's tied to the lack of physical fitness and activity. So we'll go with that in a second. Thank you, Tony.
You're welcome.
Okay, so let's start with the.
This is Jason. Just
yes.
The people on the east side, there's less exercise. They do less exercise than the people on the west side. They're less educated on the east side, and
okay.
And the other one is they're actually lower income on the east side in Central Palm. That's it.
Okay. Thank you, Jason. Okay, so as I noted earlier, per state law, we are required to use census tracts for the analysis. And I'll note that the boundaries for census tracts do not necessarily line up with jurisdictional boundaries. So there are census tracts, as you can see down here, this tract is much larger with only a small portion of it is within the city. And the same happens on the northeast and the eastern part of the planning area. We also looked at, we also noted that some of the census tracts are fairly large and they have areas that are unpopulated. So for example, the tract that covers Plant 42 is unpopulated. There are no residents noted in it. So we took that tract out of our analysis. I will also note that there are other tracts, census tracts that are partially unpopulated. So there's concentrations of residents in just a small piece of it, but the entire census tract needs to be considered because the small portion of residents that are in there qualify for the income and other criteria. And then I would also note that there's a few of the findings in our analysis that lead to additional questions regarding the data that's available to us through these state-mandated tools. So starting with social characteristics, the map here shows the percentage of non-white population. The maroon areas show areas with over 75% non-white, orange is 50 to 75%. The yellow is less than majority, so 25 to 50% range, and then the pale yellow at the south end is less than 25%. I should also note here that race or ethnicity by itself is not a health determinant, but in combination with other factors can play a role. Education levels, for example, are strongly correlated with health outcomes. The graph on the right shows that Palmdale residents have a higher proportion of those without a high school degree, as well as a college degree compared to the rest of, or not having a college degree compared to the rest of the Antelope Valley and LA County. Mortality rates generally decrease as the proportion of adults with at least a high school education increases. So there's a direct correlation between education and health outcomes. In terms of more strongly than education, income levels impact health outcomes. And the graph here shows income levels by race and ethnicity within the city in 4 major groups: white, Hispanic, Latino, Black or African American, and Asian. And there's a significant differential between the most and the least in this graph. This map shows median household income by census tract, and the threshold established by the state for the SB1000 analysis is based on the county median income as well as the state median income. The state median income is 77,510, and 80% of that AMI is 62,000 or so. The LA County median income is 69,000, and 80% of that is 440. The darkest blue on the map shows the area below the county threshold, and then the middle blue category shows the areas below the state. So the two blues in essence are what our threshold needs to be for the analysis we are conducting here. Having said that, I would also note that several of the larger tracts are essentially, or portions of those larger tracts are vacant. So the areas shown in yellow here are vacant portions of tracts. Well, as you well know, this tract here is, or this portion of is within the lava land in the sphere. It's not populated. The quarries are located here, so there's no residents within that specific geography. So just something to keep in mind. We keep these tracts in our initial analysis, but we can carve them out as we move forward. Now let's look at some of the health indicators. And please note that the source is, for the most part, Healthy Places Index. And this index compares the entire state by census tract and provides a relative rating.
Before you move on, can I ask a really quick question?
Of course.
Debbie, yeah. I had a question about the graphs. There's the median household income, the census tract, and it shows the dark blue where, you know, with the income for the dark blue. But then on the next one where it shows the vacant areas, those are shown as vacant areas, but in the household income, they're shown as having people with low income. So I'm kind of confused about that between the median household income and the vacant areas.
Yeah. Debbie, that's a really good question. As I mentioned, that the information is available for the entire census tract. So if I take the census tract here, which is surrounding Plant 42, it extends as a L. It goes to the south of Plant 42 and then wraps itself around to the east of Plant 42. Now the area which is to the east of Plant 42 is essentially vacant. There are no residents there, but there are residents in this portion to the south. But since it's the entire census tract, it colors the entire tract that solid blue, okay, which is misleading.
Yeah, that sure explains it though. Thank you. That helps.
Sure, yeah, which is misleading, right? Because it shows a huge geography as being impacted, but in reality, we should be taking those areas out. But and we do that at the very end. But for the for the purpose of the analysis, we need to consider the entire tract.
Can I ask a question?
Yes.
The census was just taken, but what census is this data?
This data is based on the ACS, which is the American Community Survey data that's updated every year. Takes a look back at a 5-year period. Okay, so looking at some of the health indicators, starting with life expectancy and leading causes of death. The average life expectancy in Palmdale is 78.5 years, which is almost 4 years less than the LA County. There's no single cause that can be attributed to this disparity. And then we looked at the leading causes of death and compared those to those in the rest of Antelope Valley as well as the county. And the top 3 causes are coronary heart disease, COPD, and stroke. And they all have the same risk factors, and those include poor diet and lack of physical activity. The leading cause of premature death is drug overdose and motor vehicle crashes, which are higher than the county as a whole, and this is for the Antelope Valley. In terms of asthma, children's rate for asthma-related emergency department visits are higher in Palmdale than when you compare those to the county by about 20%. And then rates for adults are also higher in the city, and these are for emergency room visits compared to the county and the state. The numbers for the city are 66.5, while for the county it's about 38.7, and the state is higher than that at 42 per, and this is all per 10,000 adults. In Palmdale, almost 5% of adults 18 and over have experienced coronary heart disease. And based on available data, the death rate due to cardiovascular disease in Palmdale is also a little bit higher than, about 10% higher than that in the rest of the county. The death rate due to chronic obstructive pulmonary disease in Palmdale was also fairly high. It's almost twice the rate in the rest of the county. Smoking is the leading cause, and like lung cancer, COPD can also impact non-smokers with long-term exposure to lung irritants. And there are 4 primary sources of those that fall in that lung irritant category, and those include emissions from or particulates from vehicles, active and defunct ag operations in the area, rock, gravel, and sand quarries or processing operations within the city or nearby, as well as large-scale solar farms, which are not within the city limits, but in proximity to it towards the west. We also observe higher rates of obesity for both adults and youth. And there's a link to sedentary lifestyles and long commute times and lesser use of active modes of transportation, walking or bicycling within the city. The 31% of Palmdale adults are obese, higher than the 26% within the county, and 41% of Palmdale youth are obese, which is higher than the numbers for the county, which are at 28%. And as I noted, the prevalence of obesity is tied to sedentary lifestyles lack of physical activity. Now, some of the built environment indicators. Households that pay more than 30% of their income on housing are considered cost burdened. And in the city, 45% of all households fall in that category. We look at exposure to lead, and the indicator we use for that is age of housing. Lead-based paint was banned in 1978. So 1980 is a good indicator to use, and approximately 80% of the housing within the city was built after 1980, which is great. There are, though, a few pockets of older homes, which are shown in the darkest of the blues within on the map on the screen. As we discussed in the last meeting, 46% of the residents are within a mile or 20-minute walk of a park, and parks are generally well distributed across the city. Another indicator is access to fresh foods, and we use distance to a supermarket as an indicator to determine this factor. And there's a shortage within almost the entire city in this regard. Many of the low-income tracts also have limited availability. And I should also note that there's a high concentration of fast food restaurants along portions of Palmdale Boulevard, East Avenue S, and along Rancho Vista Boulevard, which also impact access to fresh foods. These maps are a bit hard to read, but they show, they represent the heat map of collisions for vehicles, pedestrians, and bicycles. And there's a higher occurrence on Palmdale Boulevard and Avenue S and Avenue R in the portion of the city where there's more streets. So along the grid pattern of streets that you see on the east side. There is also more collisions on what are the high volume roadways, and that include SR 14, Palmdale Boulevard, which is State Route 138, and as I noted, Avenue S and Avenue R. As we have previously discussed, there's a shortage of medical services in the eastern portion of Palmdale, and almost the entire city is designated as a mental health provider shortage area. This is a federal designation, and that looks at the number of mental health providers per 10,000 population, and is established based on that data. With regard to crime and public safety, community safety has improved in recent years, and serious crime rates in Palmdale are lower than those in the county. Per 100,000 population, serious crimes are at 436 in Palmdale, while the county number is much higher at 551. And I should also note that Palmdale was recently named among the top 10% of the safest cities in California. It was rated as number 33rd in the state. These are all good metrics. And now the environmental pollution indicators. As I noted earlier, method 1 calls for looking at the composite score for Cal EnviroScreen. And what this map shows is that no area in the city has above 75% Cal EnviroScreen percentile score, which is great. So this selects no qualified disadvantaged community, but this is just one of the methods we have to use. For method 2, when we look at some of the pollution indicators, we find that the entire Antelope Valley Basin has poor ozone levels compared to the rest of the state. And this means that all low-income areas within the city would be qualified as disadvantaged communities. You only need one indicator to show up in the red zone to qualify. Even though ozone shows up as a pollution factor, the levels in Palmdale are still lower than what the state has established as the standard. The standard for Palmdale is, or the number for Palmdale is 60 parts per billion. The state standard is 70 parts per billion. The LA County as a whole, levels of ozone are at 50 parts per billion. So we are worse than the rest of the county, but we are still lower than the state established threshold. Other pollution factors show some areas that rise to the level of in the 75 percentile category, and these include drinking water contaminants on the west side, hazardous waste around Plant 42, pesticide use in the agricultural areas in the sphere of influence island, the Lava Island. And because there's a landfill on the west side, the tract which contains the Palmdale landfill qualifies in this category as well. And I would also make the point that just because the tract shows up in the top 75%, it doesn't necessarily mean that safety levels are not being met. This is a relative scoring. It looks at all the tracts within the entire state and divides them into, gives them a percentile ranking, and the ones which are in the lowest category show up here in red, which are pollution factors we need to consider. With regard to other pollution factors, impaired water bodies, PM 2.5 groundwater threats, and cleanup sites, none of those rise to the level of significance, neither do toxic release, diesel, or traffic density. On this traffic density map, you do see a little red on the bottom end, but that is because of the highway, State Route 14, which runs down the edge, and that tract reaches all the way down to SR 14. So there's no impact to be noted up here, but because that entire tract is next to SR 14, it shows up as a significant factor. And now very briefly, the conclusions. When we put the two methodologies together, method 1 and method 2, the areas shown in pink on your map are identified as disadvantaged communities. These are census tracts. And as I noted, this is primarily because of ozone pollution within the city. We also looked at a couple of other indices that are available. The Healthy Places Index that you all may have had a chance to look at over the weekend. We had shared the link for it. It notes that the central and eastern part of the city have relatively low scores, which are shown in the maroon red color. The Healthy Places Index provides overall scores, and then it has more detailed data and specific policy action areas that shape health, like housing, transportation, education, and others. The CDC has a social vulnerability index, and this uses 15 different variables to identify communities that may need support. They look at this primarily for disasters. But again, as you can see with the colors on the map, this generally falls in the same portion of the city. And now to circle back to the map of the vacant areas within the city. And when we net out those vacant areas from that map, we see that these are the smaller geographies within the city are the identified disadvantaged communities that we should be considering. So in summary, the overall conclusions are Palmdale is actually doing well for many environmental pollution factors. However, there are multiple indices that indicate there is disproportionate health impacts on low-income areas. And that there's a connection between income, race, ethnicity, and these health impacts. The general plan will need to address these impacts to be compliant with the SB1000 directive. And some of the major built environment impacts that we will continue to consider are the cost of housing, walkability characteristics, air quality impacts related to high traffic roadways, access to healthy food, and reducing pedestrian vehicle collisions. With that, I'll stop for questions, and then we have a question as well. And Melissa, if there are any comments on through the YouTube channel, feel free to share those as well.
I have a question.
Will do.
Yes, go ahead, Pat.
We're supposed to believe that our tens of thousands of cars up here are producing more parts per billion than the millions of cars and tens of thousands of trucks and airports and everything down in the Los Angeles area.
Right.
I really, I feel bad for you guys trying to sort this out and trying to make a plan, because those numbers are so skewed that it doesn't make any sense.
Pat, I have to agree with you. You know, when you look, I look at the number each day, the EPA number, and we are all almost inevitably every day we're either in the green or the yellow when it comes to air pollution. So I'm not understanding it either.
Well, like I said, I understand why LA County is using the Antelope Valley as their mitigation grounds. So they've got to make our numbers look bad. And this garbage about we have such a high rate of COPD and asthma, those numbers are garbage too. Again, I know that you have to work with those numbers to make this plan, but understanding that LA County is dumping on us. And if that's where you're getting your data, then we're gonna continue to get dumped on. And I don't know what the city council is gonna ultimately end up doing, but this whole thing, the data that you guys are working with, I feel bad for you. I really, don't have any answers for that.
Hey, Pat, have you ever considered, this is Tony, have you guys ever considered that maybe some of that pollution has nothing to do with what we're doing, but maybe pollution from, I read an article about the oil wells in Bakersfield and the impact that they not only have in Bakersfield, but the actual wind direction, and it ends up impacting the Antelope Valley as well as LA, all of LA as well as LA County. And we are a valley.
Yeah, they're going to use all of that to try and justify those numbers. But again, they're justifying dumping on us up here as a mitigation grounds by Palmdale, Lancaster. Those numbers are directly at us. And you look at the surrounding areas, Bakersfield and all that, clear over in the Central Valley, doesn't make any sense. There's nothing to justify that. But
Pat, sorry for interrupting, but I do want to note that the data we have presented is not, the source isn't LA County, it is state data that's been used, and it's all through the Healthy Places Index that if you haven't already looked at, it lists the source of the data as well as the methodology they use to develop this analysis. And I'd also note that these are percentiles. So these are comparative ways of looking at Palmdale versus all the other census tracts within the state of California. And just because Palmdale, for any one of these pollution factors, falls in the lowest or the worst 25%, doesn't mean it's worse than what is the overall average. I guess is what I'm trying to say.
All of these comparisons are with Palmdale, Lancaster, the Antelope Valley, and LA County, the rest of LA County. And if the state's coming up with the numbers, then they're just as bad as LA County, because it's a bunch of garbage. I meet with our local government relations committee every month, and I have to listen to all of this stuff. I've been doing it for years. And LA County has dumped on us, and the state too. So like I said, I good luck. I mean, you guys are going to have to sort this out and work your numbers. But the question I have now is that we have thousands of jobs coming into the Antelope Valley, and numbers are going to change. The fact that we have more older people up here per capita than younger people. And that's because after kids get out of high school, there's nothing to do here and they leave. So it leaves us old folks up here to fend for ourselves, I guess. But that's going to change. We're working on this general plan and projects up here that are going to keep kids up here. And so how soon will this plan be? Is it flexible? Because I think we're going to see major changes within the next decade or maybe less.
Pat, you've hit the nail on the head. The purpose of sharing all of this analysis wasn't to focus on the analysis, but to see how things can be different. And we'll get to that in just in a minute here. With the next slide is what are the policy directives that we can look at to address these impacts. And these aren't necessarily done in isolation. These are all interrelated. So these are things we've been talking about in all these different meetings, that if there are job training programs or if there are additional jobs which are better matched with the residents here, those will help reduce the income and education disparities. If there are higher education opportunities within Palmdale, so residents continue to stay here and go to school here and then get a job here, again, those will help reduce those disparities. So you're on the right track with that. The purpose of this conversation here and many more to come are related to how do we make changes so that the rising tide lifts all boats.
Right. I could justify what I'm saying because when they did the town and country general plan for Los Angeles County up here, they slammed us with all kinds of things that made no sense at all, and we lost. Every meeting they'd come up here and they'd shake their head and they'd listen to us, and they go down and do whatever they want to do, and then they come back with numbers that just killed us. So I've seen it over the years, and that's all.
Thank you, Pat.
This is Jason. I just want to bring up, I'm more concerned really about the health and education of Palmdale. When you say it's 20% worse than LA, that's pretty bad with the statistics you brought up. And then I really wished you guys would have took out, the airport, Plant 42, Ritter Ranch open space, the quarries, the industrial land north of Avenue Q. So we could actually really look at where people are living and we could compare the area. If you take the west side of Palmdale out of the equation, Palmdale's not that great a place to live and raise a family. And that's what I got out of all of this. That's it.
Thank you, Jason.
This is Aurora. Sorry. Sorry. I have to agree with Jason about it being really bad and about Palmdale not being that great of a place when you factor out a lot of the areas. In fact, there's the report, the key indicators of health, that actually indicates that we're worse than LA County norm, not LA County, not LA the city. But just all of those service planning areas averaged out, we're still higher than them in at least 14 different sectors. So, and one of them including like suicide rate, COPD, and overall mortality rate. So I'm just kind of curious as to which numbers we should go with, or where's the most like reliable source of information for this.
That's a good question, and I know we've others on the GPAC have asked similar questions. The reality of it is that we are not doing. We need to use for this project secondary data that's available to us. So we have data available through the state, and we have some data that's available through Los Angeles County, and then there's federal data through the Census and the American Community Survey. So we are using a combination of all of that data to and presenting that to you here today.
Yeah, and sorry, just really quick, no matter which of the data we look at, all the numbers say pretty much the same thing, right? About Palmdale being heavily impacted in terms of like health outcomes.
Several of the indices do show that the Healthy Places Index, the detailed index for Kallen-Weyer screen when we look at individual pollution factors, and the social vulnerability index from the CDC, they all show similar areas being impacted. But I will also note that the composite score for Kallen-Weyer screen shows no areas as being impacted, but that's because it's so that's the composite level. And because of ozone, it is pushing the city into this impacted area. And if you can put these numbers aside for a minute and just think about what our experiences are in the city and what we are noting in various neighborhoods within the city and what the impacts there might be. I think we need to kind of bring this analysis, which is obviously based on data that's available, but then start looking at it with what we know on the ground as being true or not true. Others who have questions, thoughts on this?
Okay, it's Juan. So according to all the data that you put before us, the entire city is impacted. Is that not correct?
I'm sorry, Juan, can you repeat that?
With all the data that you just placed before us, it would indicate that the entire city is impacted by all your studies.
What our analysis shows is that there are portions of the city that are considered disadvantaged for the methodology that the state requires us to use. And that there are impacts in these communities, in these areas, which you can see on the screen here, that have some impacts related to health outcomes. And there's a combination of built environment impacts, as well as access to medical services, which we've all acknowledged that there's a lack on the area to the east of SR State Route 14. There are also impacts related to longer commute times, and that's citywide. But you also note that if folks are in the lower income category, they have less flexibility in having time to go out to get exercise or recreate. They are working 1 or 2 jobs and with the longer commute times, they are more, they have limited time to be active, and so their health outcomes are impacted. And then cost of housing is another issue.
Okay, All right. So what are we supposed to do with this data? How are we going to rectify this? How do we take this data and apply it to our task?
So what we do with this data is understand that health and equity are issues that the general plan can and needs to address. And we can do that across these various categories that are on the screen in front of you. We can address income and education disparities, and we have some ideas about what those might be, and we want to hear from you all as to what other policies or ways we can do that. How do we address the issue of housing? As I said, for almost 40% of the residents in the city are cost burdened in terms of housing, so they can't afford to pay. They're paying more than 30% of their income for their housing costs, and that identifies them as cost burdened. So what can we do to improve the affordability of housing in Palmdale? With regard to obesity, we have some suggestions on creating walkable areas, improving bicycle facilities, encouraging opportunities for transit use, which may reduce driving, providing recreational programs and more parks and open space. So with each of these categories, there are policies that the city can, the general plan can incorporate. And that's the discussion we want to have here with you today for the next hour or so that we are together, and have continued discussions on this topic as we develop the rest of the general plan over the next year or so.
Yeah, as you pointed out, it affects this element affects so many different other parts of the general plan. And
that's right.
You got me thinking we need to drive around, look at what the ADA is, what we got to do to comply, with all these terrible health issues, that we're going to have to be facing all these terrible things. So we need to be able to make sure that the disabled people can get around to go get the healthy food that they need to do. And, it's a vicious circle here. This, I don't know, these numbers, it's not right. It's not. We need to take a look at how we can really, like you said a minute ago, come up with reality to it, because you said it's state numbers, but there's state representatives all over Los Angeles County that go up there and they tell their people what they need to do to come back down here. It just, anyway, I'm done ranting.
I would like to make a comment. This is Teresa Hambro. I've noticed.
Yes, Teresa.
I noticed over the years of living out here that we have less grocery stores. Grocery stores have closed down. So how are people supposed to get fresh produce if grocery stores close down? And the other item is we have more fast food restaurants, which are not the ideal institution to have. Because that creates obesity. You're on a long drive home, you drop by a fast food restaurant, you grab a burger, it's more calories and stuff. And then I remember earlier when we were still meeting in person, we did have a citizen of Palmdale that had mentioned, why is Palmdale letting more liquor stores open up? Well, that's another thing. Why is that happening? You have more liquor stores, you have more problems with alcoholism, you have more problems with smoking, which leads to asthma and COPD. So it all kind of generates all together. So those are some issues that have been going on in the past many years that I've been here. So I don't know if anyone else has noticed that.
Yeah, sorry, can I add to that? I agree with her 100% in terms of like the convenience stores and the supermarkets. There's certain areas of the city that have, I think it's 8 supermarkets, and they have like more liquor stores in that. They have 10, as compared to another area where they only have like 4 of them, and then they have 7 supermarkets. So that I think that all that comes into play in terms of like obesity. It's not just a matter of being able to exercise; it's being able to access these foods. There was a woman that I actually spoke to who shared with me that she is in a wheelchair, but her wheelchair is the terrain outside of her house is too rough for her to really get out much. So she literally just depends on people bringing her stuff from the the corner liquor store or something, and it's not that healthy. And she asked me to, like, she doesn't even know how to get access to certain services of the city. And I imagine that there's like countless of people who have similar stories. So I think that's something that we definitely need to consider.
Thank you, Aurora. Other questions, thoughts?
I don't know if everybody read my, it's Jason. I don't know if everybody read my email, but I kind of explained that, yeah, you have the senior citizen apartments, you have the low income apartments, you have the Black community all in, around Corson Park. And the only supermarket they had, the county moved all their offices into, and now there's no supermarket serving that population. And, it's over 3/4 of a mile to Vallarta to get to anywhere. So those people have to decide to either go to the gas station or go to the liquor store if they want something. And that has to change, And the other thing is, I would really like us just to concentrate on, if we took West Palmdale out of the equation, you could really see how many problems we have in this city and the problems we're going to have for generations to come if we don't start addressing it. And I hope after this GPAC thing, I hope the city council forms another citizen council to look at all these disparities and start addressing them. And that's what I really hope comes from tonight's meeting. Thank you.
Yeah, thank you, Jason. The general. Go ahead, Matt.
Oh, I'm sorry, I didn't mean to interrupt.
No, go ahead.
I had a couple points. So, it really goes back to commuting. I know I commuted for many, many years. And, it goes back to the point where convenience, you're just grabbing the fast food to eat. And, you work 12 hours, you drive, 4 hours, and you just want to grab something to eat and go to bed. One observation I do have is a lot of cities, especially, Santa Monica, even Lancaster, Pasadena, La Cañada, all these cities, they have frequent farmers markets, and where they take over a whole strip of area, and they bring fresh produce, and maybe that's something that we entertain for the city and promote. That might be, it's very hard for a market to come to our community and invest in our community, but if we show that we can support it through a farmers market, it might encourage like a Whole Foods come out here, etc.
Yeah, that's a great point, Matt, and it's actually on the screen here listed as well as one of the ways to encourage access to fresh foods. Palmdale today does not have any certified farmers markets as far as we know. So that would be a great. Would be really helpful to have one of those here, or at least one. The city is so large, you could have multiple over the locations for those.
Well, can I say one thing? Housing is right there, and that's probably the biggest one as far as your shopping and that goes. The way the city is right now with the grocery stores and the locations they are, it's not going to change until more housing is built.
That's right.
And you don't dictate to shopping center developers or the tenants where they're going to be. They do their studies and they go where they can see that they're going to survive. Trader Joe's took, I don't know, my partner about 2 years, maybe a little over 2 years to talk to Trader Joe's. He kept giving them numbers and giving them numbers. They say, yeah, the numbers look okay. And then finally one day they said, okay, we're ready to come to Palmdale. But that's how it works. It's they have to see the housing, they have to see the numbers. And we could say, I want a shopping center on that corner over there. It looks like a great place, but it's not going to happen until more houses are built around it. People will, shop there. So housing is the biggest one. But I got to point out that the state has handcuffed everybody. They took away our redevelopment agency money. They've got such stringent environmental restrictions or requirements on all development. It's too expensive to build houses. So we can talk about what we need to do, and that's housing. But until it's affordable to build houses, we're kind of stuck. And, you know, the growth up here is what's going to push. But, you know, I don't have an answer for that one.
Yeah, you're right, Pat. You know, the city can't dictate a grocery store to locate in a specific location or a developer to build a grocery store in a specific location. But what we can do through the general plan is establish the policies which attract the right kind of users in certain areas, make sure that the land use designations, the zoning is right to allow those. And as you noted, that there are the right number of rooftops that grocery stores or other businesses count before they locate anywhere. So, you know, it's not something that the city can, you know, wave a magic, as we all know, can't wave a magic wand and make these things happen, but it has to be a collective effort on the part of the city to make sure that the framework is in place for these changes to occur, and the private sector and the community also contributes to that in their own way to ensure that success is achieved.
Yeah, one thing with housing, this is Jason again. One thing with housing is the city has to watch out for the fees that are costing so much. It's 25% cheaper to build in Victorville than it is in Palmdale. The water meters are $30,000. School fees. We just passed the Palmdale School District bond measure for several hundred million, and then they go and raise the developer fees. So it's like they just keep getting more money, more money. It's $100,000 in fees before they even break ground. It's crazy. And this is what's hurting the middle class. And the city needs to address this. We need to address this in the general plan. How can we get all these agencies to work together where they're not just grabbing money and then not looking at the big picture? They're, you know, not helping the community with housing. Thank you.
Thanks, Jason.
I do have a quick question real fast though, as far as to that point where you kind of piqued my interest. So if the plan is made to allow for housing here, and it's assuming that these housing tracts will be filled up, so then there's places for stores here and hospital. What if one really outpaces the other? What are the control mechanisms on that? The Planning Commission ultimately controls making sure we don't build 10,000 houses in the housing areas and they get 100% capacity. But since, to these guys' point, since we have maybe difficult rules to build a grocery store, nobody builds a grocery store, and then we're stuck with all of these areas designated, but nobody utilizes some of the designations. I mean, I don't know if that's this point, but it does kind of pique my interest. You could say all you want. I want to build a store here and a hospital here, houses here, and the housing one might be perfectly suited for a builder, but not the other two.
Yeah, you're right, Colby. You know, there are several things the city can do. One is when you have these large developments come in, they usually have a phasing plan associated with them. So you would typically build the residential first because the stores follow the rooftop. So the housing gets built first, and then there's the grocery stores and the retail follows. So the city can require phasing for building those developments, the retail developments, not at the same time as the houses are built, but within a certain time frame of the completion of the residential portion. That is something that the city can consider as a policy in the general plan. what I'd like to do is we have 5 categories up here on the screen, and talk about each one of those individually, and so see if we can get some additional ideas in those that are listed here to further expand the policy possibilities for us. So let's. I'll start with food access. Someone mentioned farmers markets and encouraging those. The city can coordinate with the Certified Farmers Market Association to encourage bringing one or more to the city on a regular basis. We talked about attracting additional supermarkets. And we also talked about creating community gardens on vacant property for folks to grow produce locally, which serve the entire neighborhood. That's another example. Again, this is not a requirement, but it allows for residents to come together to create a community garden, which is community building, but also benefits the residents through the produce that's grown in those lots. And then we have providing direct food assistance for those in need. Are there other thoughts? What do you think of these 4 other ideas that we should consider?
We should be looking at our town centers and the new downtown areas as the supporting infrastructure for these ideas, for the farmers market, things like that. So you'd have like 3 locations that you could help promote those uses.
Great, thank you, Pat. Other ideas, thoughts?
I
Debbie,
love
you
the
look like
idea.
you were going to say something.
I'm sorry.
Go ahead, Terry.
I love the idea of the open air markets. We have so many areas within the entire city where we have vacant parking lots, we have vacant buildings, we have a lot of space for something like an open air market. And I think a few years back, we actually tried to do something very similar to that on the east side with having like an ethnic market. So I like the idea of having things spread out around the city. We definitely have the space and locations for it. It's just a matter of getting the vendors.
Great idea. Thank you, Terry. Debbie, were you going to say something?
No. No.
Oh. All right. Let's see. Sherry, did you have any thoughts on this topic? Putting you on the spot here.
No, I'm sorry. I heard everybody else's opinions and ideas and stuff like that, and I think that they had some good ideas there.
Okay, great. Thank you.
Another thing we heard when we were chatting a few minutes ago was the idea of kind of limiting the clustering of fast food restaurants and potentially drive-throughs, and then concentrations of liquor stores too. And I think that might work in this area for new policy ideas.
The fast food restaurants go head to head. They like the cluster. They go with their competition. Burger King likes to be across the street from McDonald's.
Yeah.
So that's not going to fly very well.
And frankly, I like them like that too.
Yeah.
You have your choice of.
Yeah, you have your choice.
Choice of in close proximity. Okay. Let's see. Let's move on to the next item, which is air quality and respiratory health. One of the ways to limit impacts on folks is to not locate homes very close to the freeway. The California Air Resources Board generally recommends, it's not a requirement, they generally recommend not locating homes within 500 feet of a high traffic roadway, so freeways in particular. So that's something we can consider. other ways are to encourage reduction in driving, and that is tied to some of the job growth we talked about, making sure that folks don't have to commute so much and have the ability to live and work in Palmdale.
I just have a comment about this. If you're going to be looking at, I understand you don't want to put the housing right next to the freeway because of the exhaust. But the thing is, when you're dealing with somebody, because I remember when my husband and I were first starting out, we did not have a reliable car, and we needed to be where we could get on a bus if our car wouldn't start. And so a lot of these things for lower income, if you're talking about putting that type of housing away from freeways, you're increasing the difficulty for them getting around and just getting to work, getting their supplies. At least I remember that's how it was when I was younger, that we wanted to be close to transportation where we could get on it really quickly. So I'm not understanding why you would want to move the housing too far away from major transportation hubs, because that increases your driving.
Yeah, Debbie, I'm talking about locating houses right next to freeways. And you're absolutely right. Locating homes which are linked with transit and other transportation routes is critical, because you can't really separate the two; those two go hand in hand.
Right.
So I just want to clarify. I'm talking about locating housing right next to State Route 14, for example.
Well, housing projects like that, you can use the amenities that we're recommending as a buffer for open space and the pools and the other things that are being recommended for high density. And then for single family res, they have the sound walls, and there's still requirements for buffering too, for green belts, things like that. So it can be recommended.
Sure. Yeah, those can be recommended. But again, to have open space areas, pools, etc., right next to the freeway where the air quality is impacted because of the particulate matter from the vehicles going by, there is a noted health impact. You can design buildings to have better air purifiers and sealed windows for noise impacts, etc. So you can build at least the interiors of protect residents while they are inside of buildings. But I think it's more challenging when you want people to be outside and enjoying the natural setting that is so is one of the reasons why people want to be in Palmdale.
Go ahead. I just another fascinating thing I read in the Audubon magazine is a lot of cities are doing tree management. And if you look around Palmdale, there are so many dead trees that were never replanted or anything from the drought. And that's what the city of LA is really doing. It's planting all these trees to help with the pollution in the area. I'd like us to do more tree management.
Thank you, Jason. That's a great idea. We can add that to the list. Matt, I know you raised your hand. Go ahead.
Yeah, when I think of respiratory health, I think of with COPD and such. Comes to mind is heavy cigarette smoke or cigar smoke, and I'm sure we can gather data looking at cigarette tax, comparative to maybe LA County, to get better data on that. But if we have a higher smoking population, maybe we can find policies to discourage cigarette sales, liquor stores, or, some type of, further restrictions to assist with that. And also, it's not something that happens overnight. So, it, definitely affects, the middle-aged elderly population. So it's something that won't correct itself, in a short amount of time.
Yeah, thank you, Matt. What do others think on that?
Idea. if I could say, sorry, in terms of the tobacco smoke, I totally agree with them. And I think it has to do, I think it kind of goes hand in hand with the liquor store clustering in terms of like the tobacco outlets. Because I know that the percentage of the households with children that are exposed to tobacco smoke are incredibly high. And not so much in every household, but it happens a lot more on the east side, where, you know, like there's kids who like, they get out of their parents' car and they reek of, you know, like whatever their parents were smoking. You know, it varies greatly where like people don't even go to the park anymore because of that. You know, there's just people like smoking all the time. So I think that it does have a lot to do with that. I think that kind of goes hand in hand with the alcohol.
Yeah.
It's interesting.
Certain cities will establish. Sorry, go ahead, Pat.
I was just going to say these are, you know, good ideas. They've been hashed around over the years, and grocery stores will not locate in places where they can't have liquor and cigarettes. So we're trying to promote the location of grocery stores, that they won't go in places that don't allow them to carry these products.
Yeah. A lot of cities will restrict liquor stores and grocery and you know, mini marts which focus on selling liquor and cigarettes, etc., within a certain distance of schools. So, you know, one can be strategic in where the limits are placed as opposed to citywide.
Sorry, if I can also add, the majority of the places that sell the tobacco and the alcohol in this particular area, like on the east side, is mostly liquor stores rather than supermarkets. So I just wanted to put that out there because there's some supermarkets that don't necessarily have both licenses, or maybe they don't have either. So I think that the problem is just the clustering of those particular outlets.
Thanks, Aurora. Others, Lourdes, do you have thoughts on this? Air quality and respiratory health. What can we do to improve outcomes in the city of Palmdale?
Don't believe the numbers.
I have a comment. Go ahead, Jason.
Go ahead.
Yeah, just real quick. I mean, we're going to have 15,000 more people that are going to live in Ritter Ranch. And those, you know, thousands of those people are going to be working at Plant 42 in some capacity. Maybe a electric tram from Ritter Ranch to Plant 42, just an idea, right down Amargosa, River, or wash might be an idea to make that community require that of Ritter Ranch.
Yeah, certainly something that could be considered in the longer term.
And I just wanted to make a comment. This is Teresa Hambro. I just wanted to make a comment about the air quality respiratory health category. As far as plants that are brought into the area, it would be nice to see plants that produce a lower amount of pollen. The sycamore trees, there are numerous sycamore trees throughout Palmdale, and they have an extremely high level of pollen. So that contributes to allergies, which goes into the asthma and continues on its cycle. So being thoughtful as to the type of vegetation, trees, bushes, whatever, to help keep the air quality better as far as pollen is concerned.
I like that.
Thank you.
That's a great comment.
Thank you, Teresa.
Okay, we're on air quality. So once again, my question is, are we ever going to have someone, a representative from our Antelope Valley Air Quality Management Board to discuss this with?
We can, Carlene, what do you think of?
I believe that we talked about inviting Brett from AVA QMD to one of our meetings, or at least I know that ABA-QMD is involved in some of our stakeholder conversations or agencies discussions. So bringing them in from that perspective, I think that we're moving into the time where it's going to be appropriate to have that kind of conversation with that agency, but they're obviously a reviewing agency of our documents. So they're involved and they review all of our local projects as well. So I think that having them at the table is going to be good. I guess if they're going to be at one of our GPAC meetings specifically, I would want to make sure that we utilize their time very respectfully. So if it is a topic that we feel like their expertise would be great, or if it's a stakeholder conversation, we can talk a little bit further about that. But obviously their expertise is very valuable and necessary for our analysis going forward.
Yeah, and air quality is one of the topics that we'll be looking at in the EIR as well for the general plan. And
one other item, if I may, in the housing and under the housing segment, was there soil sampling done on these locations that showed high incidences of problems? You didn't really go into what the problems were, but so has there been any soil sampling throughout the city of Palmdale prior to this meeting?
No, we did not conduct soil sampling in the city of Palmdale before this meeting. The data that was presented, the methodology for that is covered in the very detailed website that we had sent out earlier this week or late last week. That sampling is based on that data is based on sampling that was conducted statewide, but I'm not certain that there were specific locations in Palmdale where measurements were taken, and if they were, what those locations are. Again, you know, this is one of the issues with statewide data or census data. It's a collective. You're collecting vast amounts of data and then trying to present it in a usable form. So, you know, to get down to specific actual sites where their sampling might have been taken, that information is a little hard to come by.
And for this process in the city, for the general plan, it's not site specific. It's a broad EIR, right?
That's right. It's a program EIR. You know, there are usually if there are specific sites that have been identified already as having, let's say, contamination because they were previously a use that, like a gas station use, for example, there will need to be soil samples and studies done before that site is redeveloped as another use, especially if it's residential. But at the general plan level, we do not get into that level of detail. That ends up being a project level study that needs to be done. And with that, maybe we should move over to obesity as the next category. You know, we've heard from others today about more parks and open space, and other items on this list include, you know, creating areas that are walkable, having mixed-use areas where you can live close by and walk to in the village centers, for example, that we've been talking about in the land use alternative. You have village centers where you can walk to get coffee or buy your groceries, and walk or bike to those areas. So additional bicycle facilities within the city. And then another item is recreational programs that encourage active use. And Jason, in your email, you had listed providing walking paths and loops, exercise loops within existing parks or future parks that are that may be built. I think that's a great idea. Again, that's something we can include as a policy and an element for future design, the criteria for future park design that's established. Other ideas about how to improve general health, reduce obesity, improve physical fitness?
I'd like. Sorry. Okay. No, you go ahead,
Aurora.
Okay, thank you. I think a lot of these factors that you've listed here, it's not that we don't have them. Sometimes we do have them, but maybe like there's different circumstances that play into the reasons why people don't use them. You know, like safety being one of them, and I guess also like transportation. But I think the biggest one would probably be safety, especially for people on the east side, where they feel like they can't go to the park, or they feel like they, they've had negative experiences or something, and then they kind of keep their kids in. I know that there's people who are afraid of going out, so they just kind of rather keep their kids inside than have them outside and run the risk of something happening.
And
that's a good point, Aurora.
I just want to make a comment. Like in the summertime, by City Hall, they have, a weekly event, like bring your dog or something that we used to have. Of course, we're not having it this past year because of COVID, but maybe there can be like events that encourage families to come out where kids can have an obstacle course to run through, or maybe kind of have a relay race at the park, or something that doesn't cost money. Because when you say recreational programs, would that cost money? So I'm
in terms of organization, and the Parks and Rec department would spend manpower or
yes,
to organize those and provide facilities for the.
I've used the recreational programs that Palmdale offers, and it does have a fee for most of them if you want to have some kind of sporting event or whatever. And since we do have a more lower socioeconomic area, I think that maybe starting to promote it without a fee, and make it a fun event and kind of encourage families to come out and bring their kids out, whatever that event would be, I think might be a start. And then they can get more involved and possibly go the next level and join a recreational program. So that's just my thought.
Teresa, can I address that for just 1 second? I'm also on the library board, and it's interesting you mentioned that, because that's one of the things we're talking about right now, is getting rid of late fees and just other fees related to the library for equity purposes. So I think, equity issues, the fees that people spend, all of that stuff are things that we need to look at right now. And then the library is doing that. So I think your direction is something that a lot of people are realizing that's a real point of equity right there, is when you're charging to get into something or there's late fees.
Sorry, if I could interject real quick. I couldn't agree more. And I think that a lot of times we often forget about certain populations or certain groups of people, like for example, foster youth. And that's like a really big population with the children here in the AV. But the foster youth, like if they're charging a fee, then there's no speaking from personal experience, if they're charging a fee, then they're like less likely to participate, they're less likely to be able to go. And so I think that it does play a very important role to reducing the fees.
Thank you, Aurora.
I agree with that, because why are we charging seniors to go swimming? Or like you said, foster kids or anybody. I mean, I just could never understand why we charge all these fees, park fees, when it's only adds up to a couple $100,000 a year and income for the city, it probably costs that much just to track all those fees. So I'd like to eliminate all that too.
Yeah, I know that in some areas in the South Bay area, weight training's free as long as they are, residents within, that park area. They have yoga classes that are free and whole bunch of stuff that are free. So, maybe that would be something good for the community.
We have Parks and Rec come to our library meeting a lot. And I mean, that's something, like I said, we're talking about it now, and I'm definitely going to bring it up just from what I'm hearing today, because I know we do have Parks and Rec at our board meetings too. And I can kind of see what they're thinking, see if they're looking in those areas as well. And then I can kind of report back next time we meet.
Thank you, Debbie.
That'll be great, Debbie. Thank you.
Other thoughts on this item before we move over to housing? I know all of you have a lot of thoughts on that.
Well, I mean, just real quick on this. I'm not even really sure even what topic we're on, but this discussion point in general, at least. I mean, is there some sort of scenario where because I have a couple of nonprofits that I work with as well, including youth sports and all of that. And I think nonprofits are designed to accommodate for low cost activities and things like that. I don't know if the city's makeup is really designed for that, but is there an ability to allow access to a nonprofits, better and cheaper access and more access in some of these areas or facilities, or a percentage of every park gets designated to a nonprofit organization that gets vetted out by the city, and then that nonprofit runs a free league or something like that. It's not really in the city's makeup to just give free things away. Not against our city. I'm just saying it's just not really in the business model of a city, but nonprofits are designed for that. So if we say for every park that's out there, there is a designated park that is available for nonprofit designated company or organizations to then run these, cheaper activities or activities such as that. Is that a better direction that can be done in this kind of setting where you're setting the prioritization for use?
I think your point about partnerships with local nonprofits to improve recreational access to recreational programs is a really good idea, and that's something we should consider as a policy in the general plan. So we have two topics left, housing as well as income and education disparities. And we've talked about both of these topics in previous meetings. So let's see if there are additional ideas on that. With regard to housing, we've talked about providing diversity of housing types in the city. As we all know, the dominant housing type is single-family residential. And so we've also talked about providing other types or allowing other types of housing types within the cities, such as small lot residential, townhomes, row houses, courtyard housing, as well as apartments. Another option, and this gets to what Debbie, you were talking about earlier, is providing location near transit. So again, so that those who don't have access to a car or don't choose to use a car can rely on transit to get to where they need to go. And then, of course, we can talk about not creating areas of low income versus high income areas, but to encourage a mix of income in most housing projects. So we don't have issues that sometimes are associated with what used to be called the projects within the city. And then finally, and this is probably a more longer term policy, but something to think about, is to require housing developments to include affordable housing within this, a certain percentage. Certain cities can establish an inclusionary housing requirement for doing that. So again, ideas, thoughts on those, and if there are other ideas that come to mind.
Well, I want to just push mixed use again, because I think that's where the future is. We're starting a project in Palmdale with mixed use, and it seems to be what people nowadays want. So I think that's really important.
This is Jason. Yeah, I agree with Debbie. I think mixed use is something we have to do because it's an affordability question nowadays. I would never think, growing up in Antelope Valley, that it'd be unaffordable to live in Antelope Valley. That just tells you how much things have changed. One thing I just thought of is, you notice all the houses that are on main streets like R and K and S and stuff like that. A lot of them are backed up right. There's no backyards in the houses that are backed up to main streets. And I could never figure that out. You think you would want to move the houses to have bigger backyards that are on main streets, so there would be more privacy and less pollution from the cars driving by and sound noise and stuff like that, more trees planted. I always just wanted to always, that was just a thought.
Thank you, Jason. Other thoughts? Tony, I'll call on you.
I think I'll leave it to other folks with the expertise on housing. I think that we should always have some type of mixed income housing if we can now, because times have changed. Like Jason said, many people can't afford a house in the Antelope Valley anymore. And if you don't allow folks to have the money to buy a house, and those folks are going to live in squalor or live somewhere else, and it's not a good deal, not only for us but the rest of the U.S.
Thank you, Tony.
I had a question in regards to housing. I know I've heard it in different council meetings over the past couple of years, especially with businesses, but for housing, allowing people that do apply for loans, housing loans, the percentage of the residents actually getting approved for them. It'd be interesting to see how we compare to the county to better understand, are we just not getting approved because of the viewpoint of Palmdale, or actually based on facts like with income and credit history and et cetera?
Yeah, that's a good question. And I think we talked about that in one of our earlier meetings when we talked about housing. I think this was late 2019. Seems like a very long time ago at this point. But there are a couple of things going on. One is LA County as a whole is a high housing cost area. And so the income required to qualify for homes is much higher. And then when you compare that, the median income in Palmdale is a lot lower than what the LA County is, that makes housing even less affordable. And then, of course, there's been, at least anecdotal evidence of redlining in Palmdale after the last, the great recession of the 2007-2008. And I think that has also impacted folks' ability to get loans. I know the city has been working with banks, and staff, you may have some additional thoughts to add on this to reduce that that practice.
The redlining, the redlining is for developers, for housing tracts. As far as financing for houses for individuals to buy a house, there's no problems there as long as they qualify. And Matthew hit on a couple of those things. So, but it's the price of it's the simple supply and demand issue. We don't have enough houses, so it's pushing the prices up. And we don't have enough rentals. So that was pushing the rental prices up. And then when they started talking about rent control, then all the landlords started raising their rents to beat the rent control ordinances that came into effect. So it's just been a cause and effect, supply and demand issue. If they could build more houses, we'd be taking care of a lot of these problems. The problem is that the state's mandated solar, gray water cap, using gray water, all kinds of environmental things on all new houses. And the city and the county has started implementing those things. I think our median price up here in the Palmdale area now someplace around $360,000. To build a new house, I believe a builder has to still get about $425,000 for their entry level, for their least expensive house. And then it goes up from there. And what we're seeing is families going together to buy housing. And that introduces a whole new bunch of issues as well in neighborhoods. But that's kind of the short of it, if that was short.
Thank you, Pat. Matt, did that answer your question? Or
yeah, I think it brings up another issue in regards to getting the financing to actually help develop these projects. And I totally agree with Pat, with the different fees that are associated with building a home, and you don't see that in other states, and just based on the playing field that we have and the cards that were dealt.
Great. Other thoughts on housing before we move over to education and jobs?
Just one thing, this is Jason again. Pat's right, like more people are living in one house. There's like 5 cars in front of every house, if not 6 cars in front of every house. And there's not even enough parking in housing tracts anymore. So maybe we need to think about adding more parking spaces per house.
Or maybe we could just do parking garages that go slightly below ground level for each house, instead of using up all that space for parking.
Okay.
Well, I think that the problem with the city though is we're not set up for parking garages, and I'm sure we can do all that. But I agree with Jason, and I agree with Pat. I grew up in the San Fernando Valley, and I go to live there. Thank God they're still around, and the difference is just it's just crazy from when I grew up there. I was born and raised there, and I go down there, and you cannot find a parking spot in a residential area when there was, you could play in the streets as a kid. So it just tells me that there are 4 or 5 families deep in each one of those homes because of the affordability factor. They can't afford it, so they have to do what they have to do. And once again, you have to find a way for the affordability here and everywhere else, because if you don't, you're going to have that problem. You're creating additional problems, and it's just it's a crazy problem. And I don't know if we can fix it at our level.
So I'm going to guess that everyone on this call has at least 2 cars in their family. At least 2 cars, because back in the days you're talking about, families didn't have a lot of cars because there wasn't a lot of money or availability for automobiles, and now there are availability for automobiles. So that's changed the dynamics. And if we go to work towards the future, we have to work towards changing the dynamics. We can't keep going backwards in time. So, I appreciate everybody on the call, but we have to start looking towards the future here. And and leave that past item behind. Affordable housing is a necessity that we have to, I believe we need to work towards. And affordable housing needs to be near transportation, and transportation in the Antelope Valley is scarce because it wasn't designed for transportation, it was designed for automobiles.
One of the issues possibly is larger lot sizes in the city, not allowing smaller, like well, Anaverdy's a specific plan. 7,000 is the minimum lot size, I believe, 7,000 square feet. And that's a fairly good sized lot, but there's been some other projects that have come along and they've been able to somehow cut that down. And I think that that needs to be discouraged. It needs to be at least minimum 7,000 on everything. Because it puts driveways, one car can fit between the two driveways. But as far as construction costs, one, to go down or to go up, for parking and things like that, the cost is just astronomical. And it doesn't make sense when you have a city that has so much open space, open land. We need to work with lot sizes. My developer friends probably wouldn't want to hear me say that.
Well, Pat, I would disagree with your suggestion, because in my mind, affordable, right now we have 7,000 square foot lots as the minimum established, which means that over an acre, you're only building at 5 units to the acre, right? At the most, if you take out all the streets, etc., that's a really low density, which means that when you factor in the cost of land, housing that's built is more expensive. If you do allow, if the city does allow smaller lot sizes, you also can build smaller sized homes, which are suited to those who may not want a 3,000 square foot home. They may be very happy with a 1,500 square foot home. It's an empty nester, or senior citizens, or a young couple who are just starting up, and then they eventually may be able to afford a larger home and move into that. But the notion that we only provide large single family homes as a way to address the affordability crisis in Palmdale, I don't think that that is the direction we should pursue.
Well, with the
Well, I would agree with Pat in that I grew up in the Bay Area, and there's some really small lots up there now. In San Francisco, the houses have always been crammed next to each other. You can't find any place to park in the residential areas of the city because, like what Pat was saying, the area between the driveways of those townhomes, like near Golden Gate Park, between driveway and driveway, you have room for one small car. You can't even get a big car in there without going over into somebody else's driveway. What he's talking about is the same thing. I mean, we have group homes that are now allowed to go wherever they want to be, which is basically a commercial enterprise in a residential area. And so they're impacting, like I've got one near us, I don't know anybody that doesn't, and they're impacting traffic already. And Pat's talking about when you make those lots small, you're reducing the parking in front of your house. So I totally know what he's talking about. And I think for the majority of the houses, I tend to agree with them. We do live in an area where we still have the luxury of open land. And I think that you're less livable when you start cramming stuff together. I cannot stand the way they're building stuff up north. When I go around our house, we have a house up in Northern California too. And when I go into Stockton and I see the way they're building the zero lot line houses now, it's claustrophobic, and I would never live there. And it almost feels like the state is trying to force us into living in that kind of environment just because we've got a growing population and all that stuff I get. But we're really taking away livability. I mean, down here, we don't have some of those developments like they have in Northern California where they're on 3,000 square foot lots. I mean, Anaverdy's about, like Pat said, it's about the most dense that we have. I'm a proponent of keeping some areas with large lots. I just think it really makes a city way more livable and way more attractive and way more comfortable.
I would just, if I may, this is
Go ahead, Carlene.
Just to kind of also think back to the discussion that we're talking about today about health and equity and providing for all ranges of our community. I think that Debbie, you kind of hit it on the head at the end there, in that we should be looking towards variation and flexibility in what we're proposing. Not everyone's going to want a large lot, but providing the option of a larger lot in the city and preserving those areas of open space and that type of look and feel for residents, I think is important. It's also important to provide another option. We've heard a lot from the development community as well as our aerospace industry. We're really fortunate to have that in our community. Our aerospace industry is very prevalent and they want a variation of housing types too. So I think we have the land, like Pat talked about, we have a lot of land out here. So being able to offer the flexibility as well as that variation, I think is something that I guess that's what I'm hearing, is a little bit of options in making sure that we're not just looking towards one, certain individual, that we're thinking about the breadth of our community here and trying to think about the fabric of the people that live here.
Harleen, that's exactly what I mean. That is totally what I mean, because what I see in Northern, what I see in Northern California is a push towards all of the housing being that crammed in stuff. And it's like you said, it's preserving different options, because I totally realize some people want to be on those 0 lot lines in a townhouse because they don't have time to take care of a yard. So that I get. Right. I just want to keep the diversity and not go to one type of housing. Thank you.
We keep inheriting problems from the state and the county, and that's the ADUs. We have to deal with those. And when new houses are built, then somebody comes along and says, well, let's just close up the garage and make it a unit 2. So it's, we need to look at how we can add a little bit more room, and then even in the new neighborhoods as they're being built, to adapt to what the state and the county is mandating on us.
Right, because you got to figure we're already dealing with the state that says that you can turn your garage into another unit and then you can put a standalone unit in the back. So you're already talking about residential areas like ours, who I think that's probably going to catch on. I mean, I guess we'll see with time, but we're going to have a lot more density in areas like Rancho Vista, where there are those big lots where they can put another unit in the backyard. I saw somebody a couple blocks over is actually doing that. They put a 2-story house in their backyard. So we've got to realize that's coming too, and it's going to change the fabric of our neighborhoods as well.
I just want to add to, there's several areas in Palmdale that have large lots, half-acre lots, acre lots, but there's no paved road, there's no sewer, so they just sit there. And that's something that the city's going to have to address. How do we bring infrastructure and paved roads? We don't want people driving on dirt roads and then that dirt traveling, all through town and stuff like that. What's the city going to do? What's their plan on paving all those dirt road large lots, like between on Avenue Q, between 15th and 20th Street East, and also between 25th and 35th, 30th Street East. There's large lots back there along Avenue Q, but it's all dirt roads and the mess.
Thanks, Jason. Infrastructure and street infrastructure is something that we'll talk about more at our next meeting. And I'm looking at the clock here, and we are coming up close to our time here. But before we moved on to close up for the evening, I just wanted to get any thoughts on the last topic, which is education opportunities as well as income, how to address income disparities and creating more jobs. We have a few items listed here. Do folks have other ideas besides these?
And if nothing comes to mind at the moment, we did send out that worksheet in advance. And we'd love your
Yeah.
thoughts after the meeting as well.
I'm just going to jump in here. I think if you just look at the east side, you look at the low income levels of the households, you look at its Spanish population, you look at there's multiple families living in the houses. This is an area of the city we have to concentrate and bring up. And it's a proven fact, if people have higher education, if they have degrees and more job skills and stuff like that, that household makes more money. And that takes away a lot of the health issues, because now that family has more money, they can buy better health coverage, they can eat better, they live better, right? And then those people can afford to buy a bigger home. So I think it's so important that we have a community college on the east side of Palmdale. I think it's the key to make equality throughout the whole city. Because if you take the west side of Palmdale out of the equation, Palmdale looks pretty bad. And that's the only, I want you guys to really drive that into you, because I think education is the greatest equalizer, and we got to have it. That's it.
Thank you, Jason.
Jason, you're absolutely right. Statistically, there's a direct correlation between education and absolutely everything you talked about. But when you talk about putting on an east side, I don't think that's what we're talking about. We're talking about the whole city of Palmdale, and it needs to be a place where it's more centrally located, is kind of how I see it. But I agree with you. We need college out here, and it'll change us if we get that. It does every other community. I mean, when they put in, I watched Santa Cruz go from a backwoods place, they put in that university, and Santa Cruz is like this big old place now. Well, it was not that way when I grew up, and it was the university that made it grow. So you're absolutely right. Education is really where it's at, higher education.
I have a quick comment.
Just real quick, if you look at the Rancho Vista area, that's the oldest population in Palmdale is in Rancho Vista. And it's also the highest educated. It's also the highest income per capita in Palmdale. So we don't have to worry about the west side. We have to worry about the east side.
Thank you, Jason.
I just have one
ahead.
comment real quick. I think we need trade schools. It is nice to have universities and community colleges, but I believe trade schools are essential too. It's a balance. Not every single person is a college student. I am an educator for over 30 years. People like to work with their hands too, not just be book smart, okay? So we need a balance. And I think if we have university or community college or whatever for higher education, that's great. But trade schools are extremely important too, especially since a lot of these trades are dying. They need people. And that's my comment.
Yeah, thank you, Teresa. Actually, that was something we heard from the city council as well when we went to them and presented the alternatives. And when we come back at our next meeting and talk about the preferred land use plan, you'll see how that's been incorporated in that plan.
I think to really correct something that Jason made some comments about the west side and excluding the west side a couple of times. And I know you didn't mean excluding us completely. But I think it's important to recognize that on the west side, 60% of the students are below the poverty line on the west side too. You have multiple people living in a single home on the west side as well. Poverty is a lot more widespread than you think. Being a school administrator, I see those stats, and 60% of our kids are below the poverty level. So you're not talking about affluent children over here. Only 40% of the kids over here would be in those homes, Jason, that you're talking about, that are making that have a high education level, making a decent amount of money. The majority of them are not living like that over here. They're living more than one to a home, and they're impoverished as well. So I just wanted to throw that out there. So we realize that we're dealing with poverty. In fact, on the extreme west side, you get some extreme poverty. Now I'm talking about Lancaster now, but I mean, you've got some extreme poverty on the far west side over in Lancaster. So let's not forget, we've got folks in need all over our city.
Thank you, Debbie.
Thank you, Debbie. Okay. Since it's, I think that's it on the jobs and education. I wanted to briefly go over the questionnaire we had sent over, and we obviously don't have time to get your responses to these questions during the meeting today, but what we'd love for you to do is to fill that out, having digested the information we shared and the robust discussion we had after that, and send us your thoughts by Monday. And then we'll take a look at your thoughts and pull those together into compile those notes and send those back out to the group so everybody has the benefit of everyone else's ideas and thoughts. Does that sound good? All right. Melissa, do we have any public comment?
We don't have any public comment at this time or any responses to the polls, but we'll keep them open for folks that are watching on YouTube. And if you have any questions after the public comment form has closed, please email the general plan team at the email that's on the page now.
Thank you, Melissa. And then very briefly, we are currently also working on developing the preferred land use plan and conducting analysis and developing policies. We'll be back with you all soon and present the draft land use alternative. It will have taken into account what we heard from you all, the community, the direction we received from the Planning Commission and City Council. And the alternatives previously showed what we were thinking about the areas of change, but the preferred land use alternative will show a land use map for the entire city. So we look forward to discussing that with you at our next meeting. We don't have a date for it yet, but we should be sending that out over the next week or so once we have that finalized. So we look forward to seeing you all at that point. And I know, Carlene, you'd like to say a few closing remarks?
Yes, I'll keep it short and sweet. Just a couple of highlights throughout the discussion. I really appreciate everybody's input today. This has been a really good conversation, and I feel like it's helped set us up for success going forward. And one of the great things about the general plan is it covers the whole city. So we have a very large city here, and we have a lot of opportunities to unify our community with this document. And I'm excited about that, bringing our whole city together through the general plan. And yeah, I think that's kind of the biggest thing. And I just wanted to say thank you again. I know everyone takes time out of their day to be here, and some people are actively working during this and multitasking, and I think that's great. So we look forward to seeing you guys at the next meeting and keeping the discussion and seeing those sheets too, because I think that'll be really helpful for the team going forward. So thank you all so much.
Yeah,
and then lastly,
Melissa, go ahead. I think I was just going to mention.
Yeah, we have the presentation from tonight up on our project website. I just sent a link to everyone, but if you'll recall, our project website is palmdale2045.org. And if you navigate to the GPAC page under tonight's meeting, there's a link for presentation, and you can access that now.
And we'll also be posting a recording of this meeting on the YouTube channel. So if you would like to go view it again or recommend others to go watch the discussion, they can do so. I think it's up sometime
it's
tomorrow,
now.
Melissa?
Yep.
It's on now? Okay, great. Well, thank you, everyone. Again, we appreciate you taking the time to join us today and sharing your thoughts on this. It was a really good discussion, and I think we got some great ideas that will bring forward back to you as we develop the policy framework for the general plan. So we look forward to continued discussions with you all. Have a good night, everyone, and happy Halloween.
Bye. Night.
Thank you.
Good night.
Good night.